Click on your patient's name, Hollyoaks. Check that you have the correct patient by confirming their name and date of birth in the patient banner. It is important to note that selecting the wrong patient can result in the wrong patient being exposed to radiation. Please always double-check your patient banner before continuing. We are happy that this is the correct patient, so we can proceed. Click on the Order Entry hot link. Notice that there are two radiology tabs. Tab 1 contains plain film, CT, MRI and fluoroscopy. Tab 2 contains ultrasound, angiography and nuclear medicine. Firstly, we have plain film. Notice how the body parts have been separated out into left and right sides and more specific areas to simplify the ordering process. You will also notice that there are specialised options for specific exams or groups of exams. For example, the trauma group, which if selected, the screen will be pre-populated with chest and pelvis requests. We will see this working later in the video. However, before we move on, you need to be aware that orders or requests will be printed out in the department where the work is to be carried out. In this case, plain film will be printed out in X-ray A. For CT, notice how the body parts have been grouped more generally. So for example, a CT on a hand will be selected by clicking upper limb and a foot by clicking on lower limb. Please note that the trunk covers the chest and abdominal area. For MRI, the body parts are organised in the same format as CT and the same principles apply. Both CT and MRI requests are printed out in the respective departments so that they can be actioned as soon as possible. For fluoroscopy, these are ordered by the type of examination apart from barium enema, which is a single exam on its own. All of the requests in this tab are printed out in X-ray A, apart from the CT and MRI scans, which are emergency requests and therefore print out in their respective departments. Click on Radiology 2. So, to continue, click on the Radiology Tab 2. Here we have General Ultrasound. Again, these have been organised into body part order. Only select these options if you want the ultrasound to be carried out in X-ray B. For Obs and Gynae ultrasound, you make your selection from this list if you want your ultrasound to be carried out in maternity or EPU. If you want a general ultrasound, you just select it from the previous list so that the printout is sent to X-ray B rather than maternity. It is also worth noting that EPU has its own group of examinations specific to that department. For ultrasound Doppler, this examination has its own checkbox to simplify the request process. Next is angiography, venograph. This list contains all specialised angiography and venography, including specialised lines. Nuclear medicine is simply grouped by body area. So the patient in our example was in a road traffic accident and has lost consciousness. The investigations we would want to request are held in Radiology Tab 1, so we will need to go to this tab now. Click on Radiology 1. So from this tab, we are going to select some investigations. Select X-ray left LL. Select X-ray trauma. We will also select CT head, neck. Now click on the Add Order button. The electronic request forms will appear automatically one after the other, but do check which request screen has been opened for you by looking at the title bar. Here we are looking at the X-ray to the lower left limb. Click on the drop-down to view the priority options. HSC 205. This should be selected only if the patient is a pro forma patient. For example, they are on a cancer pathway. It is used to indicate patients that would have a yellow dot attached to their order on the paper-based system. Routine. Radiology will complete in the normal time frame. Urgent. This is to be done as soon as possible. Please note that you must phone through with urgent requests as well as placing the order on the computer. Select the urgent priority for this example. Here the date and time is the date and time the order was placed. Do not change this to the date and time you would like the examination to take place. The location is automatically filled in for you, but this is the location where the request is to be sent to. Let's continue by clicking the first drop-down arrow against exam requested. The list has been organised so that all the body parts appear depending on the body area that you have selected. In this example, the first request was for the lower left leg, and so all the areas are associated to this part. To make it convenient, the top 10 most frequently requested areas are at the top of the list. These are followed by an alphabetical list. Select 07 X-ray femur L. If you needed to request more examinations for the lower left limb, you could continue to click on Further Exam Requested drop-down arrows. Click the next drop-down arrow against Exam Requested. Select 04 X-ray ankle L. You must indicate if the X-ray is to be performed as an inpatient or an outpatient by clicking on this drop-down arrow. For this example, click Inpatient. All of the information on the right-hand side of the screen is required by radiology. Some of these fields are mandatory, including both transport and is the patient an infection risk. Click on the drop-down arrow for transport. Select Trans Trolley. Click on the drop-down arrow for Is patient an infection risk? Select Yes. If you select Yes to indicate that the patient is an infection risk, then you will need to record yes responses in any of the next 4 boxes. If you select No to the infection risk question, then these boxes can be skipped and you can move down to the patient pregnant question. In this example, our patient has a blood-borne virus, so we need to click the drop-down arrow against blood-borne virus and select blood-borne virus Yes. Click on the drop-down arrow for blood-borne virus. Select Yes. If appropriate, the patient should be asked if there is a chance that they may be pregnant. The last menstrual period, or LMP question, should be asked of women who are of childbearing age. This box is completed by simply typing in the date in the format DD/MM/YYYY. Click on the drop-down arrow for patient pregnant. Select No. Click on the drop-down arrow for injury. Select Yes. Notice how this box is for clinical comments, but the radiographer must be able to understand what the clinical question is that you need answering. Make this as clear as possible by typing in the question you want answering, with the examination you want answering. We will enter an example for you. We are reminded not to use abbreviations. Click OK. Do not free text the exam details in here instead of selecting from the drop-downs. Free texting creates an unknown exam on the Radiology Information System. In the web version of CRIS, which is accessed outside of radiology, an unknown order prevents the whole of the history for the patient being viewed until it has been rejected from the system. Now we have typed in the information, click on OK, and we will automatically be taken to the next request, X-ray trauma. Click on OK. Notice the title bar will state the request which you are making. Always check which exam the screen relates to before completing it. This can become an issue if you have selected many examinations, as the computer presents them in a system order and not the order in which you originally selected them. This trauma request is also a plain film, and so the priority has copied across from the previous request for a left lower leg X-ray. Also notice how the top 2 exam requested boxes are already filled in with chest and pelvis. This is to save you time. You can add further examinations, but this shows you how some of the common requests have been grouped for your convenience. All the other information has been pulled through from the previous requests, so once you have checked it, you can move on from the clinical information. The clinical comments are copied from the previous request. However, you can amend them so they are more appropriate to the request you are making. In this example, we will delete the text left femur and ankle injury ? And then type in another example. We will do this for you. Now we have amended information typed in, click on OK. We get another warning message appearing before the CT head and neck order is shown for us to complete. It's very important that we read these messages. We check the patient in the patient banner and then click on OK. Click on OK. You may get other prompts such as this one relating to immediate stroke patients. Do not ignore them. Click on OK. Now we can complete the CT head and neck order. Notice that priority has not been copied from previous requests. This is because this request was made from the CT group rather than the plain film group. In this case, the priority has resorted back to the default, which is routine, so we need to click on the priority drop-down and select Urgent. Click on the drop-down to view the priority options. Select the urgent priority for this example. Click on the drop-down to view the To be performed as an inpatient or outpatient options. Select Inpatient. Click on the Diabetes drop-down. Select No. It is essential that this box is completed, as it is mandatory because the information is used when a contrast is required. In other areas, the patient may require fasting before the examination can take place. Next, we have the exams requested. We need to select CT head, but to do so you will need to move down the list, so we will have to scroll down and then select CT head. Click on the exam requested drop-down. Click to scroll down. Select CT head. Because we are completing a CT, you will notice that transport has been lost. We will need to reselect Trans Trolley. Click on the Transport drop-down. Select Trans Trolley. Sometimes there are additional mandatory boxes which you must complete. This information is specific to the exam and must be provided for the examination to go ahead. In this example, you are being asked for the eGFR, which affect contrast, so it must be completed. When we click on the eGFR drop-down arrow, notice that the drop-down list also includes the level of risk and advice around controlling the risk. Click on the eGFR drop-down. Select Under 60 and No AKI. Click in the Clinical Information box. Once again, we are reminded not to use abbreviations. Click OK. As stated before, you should type in the question you want answered by the investigation. You should also type sufficient history and information about the diagnosis which might be relevant. Please note that CT and MR scans must be sanctioned by the consultant in charge of the patient. Enter the consultant's name in the comment box along with the clinical question and symptoms. Failure to comply with this may result with the examination not taking place. Click in the clinical comments box to see an example appear. Now we have the amended information typed in. Click on OK. When you click on OK for the last request of the selection of exams you have made, you'll be taken back to the order entry screen. But you will notice the requests are displayed in the bottom half of the screen. This is the holding area and they have not been sent anywhere yet. You must check a final time that 1. You have the correct patient in the patient banner. 2. That your name and details are at the top of the screen. 3. All the requests are displayed. And 4. All the requests are listed against the correct body part. This is your last chance to delete or modify your orders. Once you are happy to continue, click on Send Orders. Click Send Order. The originator is equivalent to the electronic signature for the order. In the live system, your username will be displayed here. If this is not your username, you need to delete the order, log on as yourself and replace the order. Otherwise, it is equivalent of forging someone's signature if you continue. This bleep number box is now mandatory, but you can type in an extension or contact number if you do not have a bleep. Underneath, we have the consultant responsible for the patient along with their specialty. To continue, click on OK. Click OK. Click on the cross to remove the bottom half of the screen. When finished, do not forget to deselect your patient using the patient banner. Click Deselect.